After you watch this next report, you may want to find a mirror. As we know, heart disease is far and away the #1 killer of Americans, male and female. But tonight we learn there are red flags your body is waving at you about your heart health, from your earlobes to your fingertips. ABC's Sharon Alfonsi reports on the visible warning signs.
They are the clues hidden in plain sight. Look closely at her eyes, his ears, those fingertips. What can they really tell us about the health of your heart? Everything. This 74-year-old man has an increased risk for heart disease, and we can tell just by looking at him. How? Well, look at his earlobe, at the crease on his ears. He allowed us to get up close and personal.
Did you ever notice that little crease in your ear before?
Well, I notice it because it's mine, but I pay no attention to it, just like my nose.
But Dr. Michael Wald says you should pay attention to it. He's a detective of sorts, and that crease is actually a clue.
You want to look and see if there's a diagonal earlobe crease. That literally is an infolding of tissue, and that's what's been associated with some heart disease.
One study shows that coronary artery disease is significantly more prevalent in people with a diagonal earlobe crease. Now, look even deeper into the ear.
This is kind of gross, but you say we should be looking at our earwax.
Yes. We're basically born genetically with one of two different types of earwax. There's a wet, sticky type and a dry, kind of brittle type. And if you're more of the dry, brittle type, you're at a higher risk of heart disease.
Doctors believe it could have something to do with the way people's bodies handle oil and fat. Our hands hide clues too. One of the biggest indicators of heart disease is something called nail clubbing.
The tips of the finger, the tissue gets thicker, and it kind of starts to cover up the end of the nail.
Studies show 80% of people with clubbed fingernails have serious illnesses like heart disease, lung disease, or cancer. Thin calves, less than 13 inches around, could also signal heart problems.
I thought just meant you weren't working out your calves enough, but no, this is an actual problem.
Sometimes small calves reflect issues with circulation and an increased risk of cardiovascular disease.
Whole new way of looking at your body, Sharon. I want to go back to the crease in the earlobes. How strong a predictor is that for someone about heart
Well, there
problems?
was one study that said if you have creases in both earlobes, that you could have 70% more likely chance that you're going to have some kind of heart disease.
Wow, that is big. So tell me about the other things. You look in the mirror, you see them. What do you do with them? Do you take them to your doctor and say, I have thin calves? What do I do?
Exactly. Don't panic, because these are just indicators. It's a good jumping off point for a discussion with your doctor. But point out to him, say, hey, I noticed this, or I'm looking at my legs. We even looked at, the 5 o'clock shadow. That's a good thing for men, because it means you have more testosterone. The more testosterone you have, the less likely you have to have heart disease.
All sorts of secret clues your body is giving you.
Look in the mirror.
Look in the mirror, and you'll be back, I know, later with other illnesses and other predictors you can see in your body. Thank you, Sharon.